When we think of hormones, we often imagine something deep within the body, unseen, silent, and perhaps even mysterious. But what if I told your body is actually giving you visible signals, external clues that are right in front of you? All you have to do is look in the mirror. Today, I want to walk you through 7 powerful signs of hormonal imbalance that are reflected in your appearance. These aren't abstract symptoms. These are things you can see right now, right on your face, skin, hair, and body. And the good news is, once you recognize them, you're already halfway toward correcting them. When you look into the mirror and notice that the outer third of your eyebrows appears to be thinning or disappearing altogether, you might think it's just part of aging or the result of plucking. But in many cases, it's something much deeper than that. Something hormonal. The thinning of the outer part of the eyebrows is one of the most visible, underappreciated signs of a condition called hypothyroidism, or low thyroid function. The thyroid gland, a small butterfly-shaped gland located in the neck, plays a critical role in regulating metabolism, energy production, and cellular turnover throughout the body. One of the areas it affects most visibly is hair growth. Hair follicles are extremely sensitive to hormonal shifts. When thyroid hormone levels drop, the body conserves energy and begins to reduce the function of non-essential systems. One of the first places this shows up is in the growth cycle of hair. Hair on the scalp, eyebrows, and other parts of the body goes through phases of growth: anagen, rest telogen, and shedding catagen. Thyroid hormone helps maintain the anagen or growth phase. Without sufficient hormone levels, hair prematurely enters the telogen or resting phase, and that results in slower growth, thinning, and eventual hair loss. The outer third of the eyebrows is particularly vulnerable because the hair follicles in this region have shorter growth cycles and are more dependent on consistent thyroid stimulation. It's not just any kind of hair loss. It's specifically the lateral or outer portion of the eyebrows that tends to thin. This pattern is so distinct that it's been clinically recognized for decades. It's sometimes referred to as Queen Anne's sign, based on historical portraits that showed this characteristic appearance. While genetics and grooming habits can contribute to eyebrow thinning, when the outer third disappears in the absence of plucking, it's time to suspect a hormonal imbalance. In many cases, this sign appears long before more obvious symptoms of hypothyroidism like fatigue, weight gain, cold, intolerance, or constipation show up. That's what makes it such a useful and early visual cue. Low thyroid function affects more than just hair. The skin becomes dry, the nails brittle, and there may be puffiness in the face, particularly around the eyes. But the loss of lateral eyebrow hair is one of the few signs that can be visually confirmed without a medical exam. It's a kind of biological signal, a flag waving from your forehead, that your internal thermostat is out of sync. And it doesn't happen overnight. This kind of eyebrow thinning is typically gradual, occurring over weeks to months. Most people don't notice it at first. They may blame it on aging, makeup practices, or simple genetics. But when you compare older photos or inspect closely in the mirror, the change becomes clear. The underlying mechanism goes even deeper. Thyroid hormone influences protein synthesis, mitochondrial function, and overall skin health. A deficiency leads to impaired collagen production, slower tissue regeneration, and changes in skin texture, all of which contribute to changes not only in the eyebrows but in the overall appearance of the face. For many individuals, eyebrow thinning is accompanied by a dull or tired facial appearance. The eyes may look sunken, the skin may lose its glow, and there may be a subtle loss of definition in facial features due to fluid retention and skin changes. Autoimmune thyroid disease, especially Hashimoto's thyroiditis, is one of the most common causes of hypothyroidism. In this condition, the immune system mistakenly attacks the thyroid gland, leading to inflammation and decreased hormone production over time. Interestingly, this autoimmune process often begins years before a person is formally diagnosed with hypothyroidism. During this period, the person may experience subtle changes in mood, energy, skin, and hair, but not enough to warrant medical evaluation. That's why recognizing early signs like eyebrow thinning can be critical for early detection. Another layer to consider is the role of nutrient deficiencies in this process. Selenium, zinc, and iodine are all essential for optimal thyroid function. When the diet is deficient in these nutrients, thyroid hormone production and conversion can slow down, worsening symptoms. Biotin and iron also play a role in hair growth. Low levels of these nutrients can mimic or exacerbate thyroid-related hair loss. Sometimes, a combination of mild thyroid dysfunction and suboptimal nutrition can amplify visible symptoms. Stress also plays a role. Chronic stress raises cortisol, and elevated cortisol levels can interfere with thyroid hormone production and conversion. Cortisol can also push hair follicles into a resting phase, compounding the hair loss. In fact, people under chronic stress often experience general hair thinning and may see acceleration of eyebrow loss, particularly if there's an underlying thyroid vulnerability. In clinical settings, physicians often rely on more than just lab values to assess thyroid function. They consider symptoms like fatigue, cold hands and feet, depression, and yes, eyebrow thinning. Sometimes lab results fall into the normal range, but a person still experiences hypothyroid symptoms. This condition is sometimes referred to as subclinical hypothyroidism or functional hypothyroidism. In such cases, visible signs become even more important. The mirror, in a very real sense, becomes a diagnostic tool. Observing this kind of detail may seem like vanity at first glance, but in reality, it's a form of self-awareness. The body has many ways of signaling when something is wrong, and visible changes in hair, skin, and nails are some of the most accessible. They don't require blood tests, imaging, or devices. They just require attentiveness. When you observe a puffy, pale face with noticeably dry skin in the mirror, what you're seeing may be more than just tiredness or a temporary change in weather. These changes in your facial appearance often reflect underlying hormonal imbalances, specifically related to thyroid dysfunction. The thyroid gland is responsible for producing hormones that regulate metabolism, fluid balance, and skin regeneration. When the gland underperforms, known medically as hypothyroidism, several physical changes begin to manifest, and the face becomes a key indicator of what's happening internally. Puffiness in the face, especially around the eyes and cheeks, is a hallmark sign of low thyroid function. This puffiness is not typical bloating from diet or salt intake. It's a distinct, non-inflammatory swelling that occurs as a result of accumulated substances in the skin known as glycosaminoglycans. These complex sugars are normally kept in balance, but in hypothyroidism, they build up in the skin and connective tissues, drawing in water and causing a soft, swollen appearance. This is referred to as myxedema and is one of the clearest signs of advanced thyroid dysfunction. The face may look rounder, heavier, and unusually duffy, even if the individual hasn't gained significant weight elsewhere in the body. The skin, too, undergoes dramatic changes. One of the earliest and most noticeable is dryness. Thyroid hormones play a critical role in skin cell turnover and the function of sebaceous glands, which produce oil. When these hormones are deficient, skin regeneration slows down and oil production decreases, leading to rough, scaly, or cracked skin. This dryness is particularly noticeable on the face, where environmental exposure compounds the issue. The forehead, around the mouth, and under the eyes may develop a dull, parched appearance. Makeup doesn't apply as smoothly, and the skin may feel tight or itchy, even if moisturizers are used regularly. Along with dryness, the complexion itself often becomes pale. This isn't type of paleness that comes from staying indoors or avoiding the sun. It's a deeper, more systemic kind of pallor. Part of this is due to decreased blood flow. Hypothyroidism leads to reduced circulation to peripheral tissues, including the skin. Blood vessels constrict, and the oxygenation of the skin decreases, resulting in a cooler, paler appearance. In some cases, the skin may even appear yellowish due to the accumulation of keratin, a pigment normally converted into vitamin A by the thyroid. When thyroid function is low, this conversion slows, and the pigment begins to accumulate in the skin, subtly changing its hue. In many individuals, this trait of facial puffiness, dryness, and pallor is so gradual that it often goes unnoticed until it becomes more pronounced. People may assume they're just aging or not getting enough sleep. But the truth is that these changes are often among the first outward signs that something is wrong hormonally. If these visual cues are accompanied by fatigue, cold sensitivity, slow heart rate, or unexplained weight gain. They form a clinical picture that strongly points to thyroid dysfunction. Another aspect to consider is the texture of the skin. In hypothyroidism, the skin often becomes thicker due to the accumulation of mucopolysaccharides and decreased enzymatic activity. This can give the face a slightly coarse, uneven texture, especially when compared to previous photos or younger years. It's not just dry, it's texturally different. This change can be subtle but noticeable, particularly around the jawline and cheekbones. The eyes may also show signs of thyroid imbalance. In hypothyroidism, fluid can accumulate around the eyes, leading to puffiness and sometimes a baggy appearance under the lower eyelids. This isn't the type of eye swelling that resolves after a good night's sleep. It tends to be persistent and may worsen in the morning due to overnight fluid retention. The area around the eyes may appear shadowed or slightly discolored as the skin thins and circulation decreases. Interestingly, these facial features are often missed in conventional medical settings unless the practitioner is specifically trained to look for them. Lab tests may not always tell the whole story, especially in early or subclinical hypothyroidism. In these cases, the visible signs in the mirror become one of the most important diagnostic tools a person has. The combination of puffy facial features, dry skin, and pallor tells a story about cellular metabolism, protein synthesis, and fluid dynamics, all of which are orchestrated by thyroid hormones. Stress, dietary deficiencies, and autoimmune processes can all contribute to reduced thyroid function and amplify these visible signs. Chronic stress, for instance, raises cortisol, which can suppress thyroid hormone production and block its conversion into its active form, T3. Nutrient deficiencies, particularly in iodine, selenium, and iron, can interfere with thyroid hormone synthesis, further lowering hormone levels and worsening symptoms. These deficiencies are not uncommon and may go unnoticed unless specifically tested for. The good news is that these visual symptoms often improve with appropriate treatment or lifestyle changes. Once thyroid hormone levels are corrected, either through medication or nutritional intervention, many people notice that their skin regains its moisture, puffiness subsides, and natural color returns to the face. The texture of the skin smooths out, and the eyes begin to look more alert and less swollen. These visual improvements reflect deeper physiological healing and restoration of hormonal balance. When you notice that your skin has become unusually oily or that you're experiencing frequent breakouts, especially as an adult, it's often tempting to blame products, diet, or poor hygiene. But in many cases, persistent oily skin and acne in adulthood are connected to hormonal shifts, specifically the rise of androgens like testosterone and dihydrotestosterone, or DHT. These hormones are naturally present in both men and women, but when they become imbalanced or overly dominant, they begin to stimulate the sebaceous glands in the skin, triggering an overproduction of sebum. This excess oil can clog pores, trap bacteria, and lead to inflammation, which presents visibly as acne. The face is one of the most androgen-sensitive areas of the body. Within the skin are androgen receptors, particularly concentrated in areas like the T-zone, forehead, nose, and chin. When androgen levels rise or the skin becomes more sensitive to their effects, these receptors are activated, causing the sebaceous glands to enlarge and secrete more oil. This oil mixes with dead skin cells and environmental debris, creating the perfect environment for Propionibacterium acnes, a bacteria that thrives in clogged pores and leads to inflammation, redness, and pus-filled lesions. This is why acne under hormonal influence tends to be deeper, more cystic, and more persistent than teenage acne. Adult acne that is hormonally driven typically appears along the lower face, especially the jawline, chin, and neck. This pattern is different from the acne seen during adolescence, which more often affects the forehead and cheeks. This lower face concentration is a strong clue that hormones are playing a dominant role. In women, this type of acne can flare cyclically around menstruation due to natural fluctuations in estrogen and progesterone, which indirectly influence androgen levels. However, in more chronic cases, especially in conditions like polycystic ovary syndrome (PCOS), the androgen levels may be elevated consistently, leading to continuous outbreaks, often resistant to over-the-counter treatments. It's important to note that elevated androgens don't always show up on standard blood tests. Sometimes, the hormone levels are technically within normal limits, but the skin's sensitivity to androgens is heightened. In these cases, the sebaceous glands behave as though there's an androgen excess, even when the bloodstream levels look fine. This phenomenon is known as relative androgen dominance. Other times, the balance between estrogen and androgens shifts, with estrogen declining while androgens stay the same or rise slightly, tipping the scale toward oil production and skin disruption. In men, anabolic steroid use or testosterone replacement therapy can trigger sudden increases in oiliness and severe acne. Athletes or bodybuilders who use these substances often a rapid change in skin texture, sheen, and breakouts across the back, shoulders, and face. This is because synthetic or exogenous testosterone converts to DHT, and DHT is far more potent in its effect on sebaceous glands. Even without external hormone use, some men naturally produce higher levels of DHT due to enzyme activity, particularly 5-alpha reductase, or metabolic conditions that enhance androgen conversion. Cortisol, the stress hormone, can also contribute to the picture. Chronic stress increases cortisol levels, which in turn may disrupt normal hormonal feedback loops and lead to elevated androgens. Additionally, cortisol stimulates sebum production and weakens the immune system's ability to keep bacterial growth in check, compounding the effects of androgen-driven oiliness. That's why high-stress periods often coincide with flare-ups of breakouts and greasy skin, even in adults who didn't hack during adolescence. Diet and insulin also play supporting roles in this hormonal cascade. Diets high in refined carbohydrates and sugars cause repeated insulin spikes, which increase insulin like growth factor 1 IGF-1. IF-1 stimulates androgen production and sebaceous gland activity. Over time, this hormonal environment contributes to oilier skin and worsens acne, even in individuals who don't consume greasy foods. Dairy products, particularly skim milk, have also been linked to hormonal acne, possibly due to the presence of hormones in the milk or its effect on IGF-1 production. Skin texture also changes under the influence of androgens. Pores may appear larger due to consistent oil output, and the surface of the skin can take on a glossy, shiny appearance, especially in the mid-afternoon when oil production peaks. Makeup may not stay in place, and blotting sheets or powders may be used frequently to manage the excess sebum. Despite these efforts, the root cause remains hormonal, and topical treatments often fall short. Acne that doesn't respond to conventional skincare products, especially when it occurs in adults, is a strong signal that internal hormonal dynamics are at play. In some cases, people with oily skin and acne also experience other signs of hormonal imbalance, such as increased facial hair growth in women, irregular menstrual cycles, mood swings, or weight gain around the abdomen. These accompanying symptoms help paint a fuller picture of what's happening beneath the surface. It's not just about pores or oil, it's about a deeper endocrine pattern that's affecting multiple systems, including the skin. Environmental toxins, endocrine disruptors in personal care products, plastics, and even poor sleep can further exacerbate this hormonal imbalance. Lack of sleep, for example, increases cortisol and decreases the body's ability to regulate other hormones efficiently, creating a vicious cycle where oil production and acne continue to spiral despite efforts to manage it from the outside. Recognizing the link between oily skin, adult acne, and hormone function can provide the clarity needed to take the next step toward balance and skin restoration. When you begin to notice dark, velvety patches of skin developing around your neck, under your arms, or in the creases of your body, it can be easy to dismiss them as dirt, friction, or pigmentation changes. But in many cases, these patches are one of the clearest visible signs of a hormonal issue that goes much deeper: insulin resistance. These patches, medically known as acanthosis nigricans, often appear gradually, and although they're painless and non-itchy, they reflect an internal hormonal imbalance that affects how your cells respond to insulin, a hormone critical for regulating blood sugar. Insulin resistance occurs when the body cells become less sensitive to the effects of insulin, causing the pancreas to produce more and more of it in an attempt to push glucose into the cells. This excess insulin in the bloodstream doesn't just affect glucose metabolism. It also stimulates growth in certain skin cells, particularly keratinocytes and dermal fibroblasts. The skin begins to thicken, darken, and develop a slightly raised, velvety texture. While it can happen anywhere on the body, it most commonly shows up on the neck, underarms, groin, and sometimes even on the knuckles or elbows. The pigmentation often appears brown, gray, or almost black, and may initially look like a patch of unwashed skin. This type of skin change is especially common in people with prediabetes or type 2 diabetes, but it can begin years before blood sugar levels become high enough to be diagnosed as diabetes. That makes it an early red flag, a warning signal from your skin that your body is struggling with glucose management. In fact, some studies suggest that the presence of acanthosis nigricans is a stronger predictor of insulin resistance than blood sugar measurements alone, especially in young adults and adolescents. This makes it a powerful clinical clue that shouldn't be ignored. The hormone insulin does more than just manage blood sugar. It also acts as a growth-promoting hormone. In high levels, it binds to insulin like growth factor receptors in the skin and triggers cellular proliferation, particularly in the epidermis. This leads to the development of thickened, darkened patches, which can sometimes be mistaken for a fungal infection or skin irritation. Unlike simple hyperpigmentation, however, these patches tend to have a characteristic texture, soft, velvety, and slightly raised. In some individuals, the affected areas may develop a slight odor or become irritated due to friction or sweating, but the root cause remains hormonal. In women with polycystic ovary syndrome, PCOS, this condition is particularly common. PCOS strongly associated with insulin resistance even in women who are not overweight. In these cases, dark neck patches may appear in combination with other hormonal signs such as hand, facial hair, or irregular periods. The insulin resistance drives excess androgen production, which then disrupts normal ovulatory cycles while also affecting the skin in multiple ways. This combination of metabolic and reproductive hormonal dysfunction shows up externally through several visible skin changes, with acanthosis nigricans being among the most noticeable. Lifestyle plays a key role in both the development and reversal of insulin resistance. Diets high in refined carbohydrates, sugary beverages, and processed foods drive repeated IN spikes, which over time lead to the blunting of insulin receptors. Sedentary behavior, chronic stress, and poor sleep also contribute to this pattern. The skin, being highly sensitive to metabolic changes, begins to mirror what's going on inside the body, making it one of the most accessible diagnostic tools we have without lab tests or invasive procedures. In some cases, medications or hormonal disorders such as Cushing's syndrome or hypothyroidism can also contribute to the development of these skin patches, but insulin resistance remains the most common underlying factor. Even in children, the appearance of dark neck patches can be an early sign of metabolic dysfunction and a predictor of future risk for type 2 diabetes if early interventions aren't made. Recognizing these changes and understanding what they signify can offer a valuable opportunity to course correct before more serious complications arise. When you look closely at your scalp, especially around the crown or top of the head, and begin to notice thinning or a widening part, it may be more than just aging or genetics at play. Hair thinning or balding at the crown is often a visible marker of hormonal imbalance, particularly involving androgens such as dihydrotestosterone or DH. DHT is a potent derivative of testosterone that plays a major role in the process of hair follicle miniaturization. In both men and women, hair follicles in the crown and frontal areas of the scalp are genetically sensitive to DHT. When levels of this hormone are elevated, or when follicles are overly responsive to it, the hair growth cycle begins to shorten, and the hairs that grow become thinner, weaker, and eventually stop growing altogether. This process doesn't happen overnight. It's a gradual, often frustrating change that can take months or even years to become noticeable. At first, you might see more hair in your brush or the shower drain. Then, over time, you begin to observe visible thinning where the scalp was once fully covered. The hair part may look wider in photos, or your scalp may be more easily seen under bright lighting. In men, this typically follows a pattern starting at the temples or crown, while in women it tends to show as diffuse thinning across the top of the head with preservation of the hairline. This kind of hair loss pattern strongly suggests an androgenic influence, even in women who have normal blood levels of testosterone. What's important to understand is that hair follicles are extremely hormone-sensitive structures. Their health and productivity depend on the balance of several hormones, not just testosterone. Estrogen helps protect follicles from DHT's shrinking effects, and when estrogen levels decline, as they do with age, menopause, or hormonal disorders, DHT may gain the upper hand. This is why women may begin to experience hair thinning in their 30s or 40s, particularly if they have polycystic ovary syndrome, insulin resistance, or are going through perimenopause. In these cases, the body's hormonal landscape shifts in a way that tilts toward androgen dominance, and the hair responds accordingly. In men, hair thinning or balding at the crown is often attributed solely to male pattern baldness, but there's more to the story than genetics. While there is a hereditary component, the conversion of testosterone into DHT is influenced by an enzyme called alpha reductase, which varies in activity from person to person. Higher enzyme activity leads to greater DHT production, accelerating follicle miniaturization. External factors like chronic stress, poor diet, inflammation, and even certain medications can also increase DHT levels or exacerbate the body's sensitivity to it. This makes lifestyle and hormonal balance critical components of understanding and addressing crown hair loss. Hair loss caused by hormonal imbalance may also be accompanied by other visible signs. Increased oiliness of the scalp, breakouts along the jawline, unwanted hair growth on the face or body in women, or changes in skin texture can all point toward excessive androgen activity. These additional clues help differentiate hormonal hair thinning from other types like telogen effluvium, which is typically triggered by acute stress, illness, or nutrient deficiencies and tends to affect the entire scalp rather than a specific area like the crown. In some individuals, scalp inflammation or itching may also accompany androgenic hair thinning. This low-grade inflammation may not be overtly visible, but can contribute to degradation of the hair follicle environment. Over time, the hair becomes finer, growth slows, and previously active follicles may become dormant. Without intervention, these changes can become permanent as the follicle's ability to regenerate is lost. Recognizing the role of hormones in this process is crucial to preventing further loss and restoring a healthier hormonal environment that supports hair retention and regrowth. When you notice that your limbs appear to be shrinking in size, your arms and legs look thinner, while fat seems to be accumulating around your belly, face, or upper back, what you're observing may be a reflection of significant hormonal imbalance. Specifically, this pattern often indicates low testosterone levels or elevated cortisol, the body's main stress hormone. These hormonal shifts alter the way your body stores fat and maintains muscle, and over time, the effects become clearly visible in the mirror. The body starts to lose lean mass in areas where muscle was once prominent, while simultaneously holding on to or increasing fat in central regions, creating an imbalance in body shape that was not previously there. Testosterone is a key hormone that plays a critical role in muscle protein synthesis. It promotes the development and maintenance of muscle mass by stimulating muscle fiber repair and regeneration. When testosterone levels decline, which often happens with age, chronic illness, or certain medications, the rate of muscle breakdown begins to exceed the rate of repair. This process, known as sarcopenia, leads to gradual muscle wasting, particularly in the arms, legs, and shoulders. The muscle loss is not always accompanied by weight loss, because the loss of lean mass is often masked by an increase in fat mass. This creates the illusion of weight stability or even weight gain, while lean tissue is silently disappearing. At the same time, cortisol influences how and where fat is stored. When cortisol levels are elevated for extended periods, such as during chronic stress, sleep deprivation, or metabolic dysfunction, the body begins to favor storing fat in visceral areas, deep within the abdominal cavity and around organs. This leads to central obesity, which is the hallmark of stress-related fat gain. High cortisol levels not only promote fat storage, but also actively break down muscle tissue to supply the body with glucose through a process called gluconeogenesis. This results in a double burning muscle wasting combined with increased fat deposition, particularly around the midsection, face, and sometimes the back of the neck and shoulders. This redistribution of body composition changes the overall shape and tone of the body. The limbs may look weaker, the muscles less defined, and the skin looser due to reduced underlying support. The midsection, in contrast, becomes fuller, rounder, and more prominent, often accompanied by a bloated or distended appearance. These changes can be subtle at first, but over time they become more dramatic and difficult to reverse without addressing the underlying hormonal imbalance. Even individuals who exercise regularly may find it increasingly difficult to build muscle or lose belly fat, which can be frustrating and confusing if they are not aware of the hormonal causes behind these changes. In men, low testosterone is often associated with symptoms like decreased libido, low energy, mood changes, and reduced physical performance, alongside visible changes in muscle tone and fat distribution. In women, the decline in estrogen and testosterone during menopause contributes to a similar pattern of muscle loss and increased central fat gain. These changes not only affect physical appearance, but also have broader implications for metabolic health, increasing the risk of insulin resistance, cardiovascular disease, and inflammation. Chronic elevation of cortisol also affects sleep, appetite, and energy levels, creating a feedback loop that reinforces poor habits and further disrupts hormonal balance. For instance, high cortisol can lead to increased cravings for high sugar, high fat foods, which contribute to more visceral fat accumulation. Poor sleep, in turn, reduces testosterone production and raises cortisol further. The visual signs that appear in the mirror, shrinking limbs and expanding midsections, are not random or purely aesthetic changes. They are reliable indicators that the body's anabolic-catabolic balance has shifted unfavorably, and that hormones involved in muscle maintenance